Hi, I'm Jossie Hoff, one of the family practice physicians here at Harbor America in Rugby.
And I am Sherry Geisler. I am a resident of Rugby.
And today, Sherry's with us to kind of tell us her story about having COVID as she went through it last year and was a patient here at Harbor America.
Well, it kind of started when the big breakout here, actually in North Dakota. So towards the end of October, I kind of started feeling pretty icky. Did go to work, was wearing my mask, started with a sore throat, didn't think much of it. I'm on the phone all day, felt good next couple days. A few days later, I was really exhausted, getting tired, and just tired, normal, busy. And it wasn't until a Friday morning of that week where I'm like, something's not right. I couldn't lift my arms up. It took me forever to get ready, and I ended up going to work. I couldn't get back up or anything, so I did end up going to work. And once staff started showing up, I did say, I think I better probably go get tested. And so I got tested, and I got the results on a Monday. So the Monday following it was inconclusive, of course.
Yep.
And so I rested the whole weekend. My husband actually left for Montana, so I had just the kids with me. I couldn't really take care of them. And then I ended up testing again on Monday. I came in here for a rapid test, and that was negative. I also asked, well, could it be the flu? Can I get tested for that? Well, I guess I was kind of past the window to get Tamiflu if I needed it.
Sure.
And so the big thing was just getting rest. And so finally on Wednesday of the following week, I went to, the county was having a little COVID.
One of the drive-ups,
yes.
Probably, huh?
Yep.
Sure.
Yep. So I made it in there, and I was the only one that actually, in the Army, and I was the only one that tested positive out of that whole bunch. And finally got some answers. Mm-hmm. So, but by then, my husband wasn't back even yet, but I had to get the kids to school and whatever. So they ate frozen pizza forever.
Yes.
And whatever I had in the pantry. But then, so I was in bed as soon as I dropped him off from school. Now I didn't work. I work full time, but I couldn't. There's no way I could get out of bed. And then I found out I was positive. So it wasn't until later that week, and I want to say it was probably now the end of October, I started feeling a little bit better. I'm like, okay, I can actually get up and get down to watch TV or whatever. But the worst part of it, the whole ordeal before I went into the hospital, was the body aches. I've never been in such pain before. Absolutely horrible. Like I could lay on my side. It actually felt better to lay on my right side for some reason. But I couldn't even lay on my side with my legs touching. They hurt. Like my clothes hurt. Everything hurt. And I couldn't sleep because every time I moved, I would hurt. It hurt. I didn't lose my taste or smell. I don't think I was running a fever. I couldn't even get out of bed really to check on it. Sure. So I did actually start feeling better. And then it was a Saturday afternoon, and I tried to take a shower, and I couldn't make it through. I kind of started to pass out. And so I did get out of the shower and made it back to my bed. I was dripping wet. I didn't have the energy to actually dry off, so I waited a little bit till I could dry off, put a little clothes on. That whole rigmarole thing took me probably about an hour from the shower to when I could actually get dressed. And wow, my husband was back by that time. Kids were still eating frozen pizza, whatever they could find.
Surviving.
Yeah. So it was at that time where finally, and I should have gone in long time before that. So it was about that time where I finally said, I think I need to go in. And so he did call the on-call ER doctor or whatever and said, bring her in. Yep. Mm-hmm. Yep. And so I could barely make it into the car. I felt good. And then all of a sudden it was downhill again. I couldn't breathe, passing out, everything. And so I did get admitted. Obviously right away they did chest x-ray, which I could barely stand for. Like I had to ask to sit between the views that she was taking. And there was a gentleman, I believe the day before, if I remember right, that got transferred out, and he took the last ICU bed in North Dakota available, or in Fargo, I believe. And so I couldn't get transferred out.
So you were with us.
I was with you guys, and it was great. Like that is the one thing that I do remember is the care that I got here was unbelievable. And it's amazing how these nurses and doctors put their patients before themselves and even their own family. Like, I saw the same nurses work endlessly. I got great care.
Good.
Can't complain at all.
Good.
But I did start to feel better once I started getting, I'm going to say the medication wrong, remdesivir. So I started feeling better after that, and I believe I was on some steroids. And I could finally make it to the bathroom without any help. So that was good. But even taking a shower here in the hospital, it took all I could to actually get to the bathroom, get to the shower, and make it through. But it was tough. I wouldn't want anyone to go through that.
Yeah, that's profound from a normal functioning working person.
Well, I'm pretty healthy for the most part, I think.
Yeah.
So it was interesting, and like I said, don't think you're immune to getting it.
No, even healthy, normal, healthy people. Yeah. And how about like when you went home? Did it take you a long time to feel normal? Do you feel normal now?
I still don't feel normal.
Yeah. What
as normal as can be. I still struggle. I think that's one of the hard things that people that haven't had it maybe don't realize, that you still struggle. Right after, I did experience a lot of shaking, but I don't know if that was because of my inhaler. Like, I got started on inhaler when I was discharged because I was so short of breath, but I was trying to give a flu shot, and I'm like, I'm really not nervous. I couldn't stop the shaking, so I couldn't even really do it as I was giving the flu shot. So, and then COVID memory, I think it's a real thing. I think I've gotten better where I can remember things better.
Like brain fog, you mean?
Yes, it was horrible. And I really still have to think about things in the past.
That's a really common thing, actually.
Is it?
That brain fog, and it's hard for people to describe that.
It is. It's almost like pregnancy brain. You forget things, and then I still struggle with the shortness of breath. It's bad. Even just sitting talking, I'm pretty winded right now. I go for walks in the evening. I try jogging as much as I can. But even just sitting, talking, I get really winded.
And you don't have any underlying respiratory illness, no asthma as a kid or anything like that?
Nothing.
Yeah. Isn't that crazy?
So no.
And it's been almost a year now.
Yep.
Right?
It has. Yep. Almost a full year. So definitely the side effects still linger. I guess I had some renal damage. I had COVID on both lungs, but I believe the right side was worse. So I don't know why it was easier for me to lay on my right side. But I had oxygen, and then, yes, all the remdesivir, the steroids, and then just my normal meds that I take anyway.
Yeah.
So, yeah, I'm feeling better, but definitely still some residual side effects. So I don't know how my lungs are scarring or whatnot.
Right.
Everything's starting to come back. But it's almost been a year.
And you're still using your inhaler then. That's crazy, isn't it?
Yeah, which may explain the shaking, but I have that anyway sometimes still, even without it.
So did you and your family opt to get vaccinated then?
Well, I did as soon as I could. I believe it's a 3 month after my discharge is when I had it, when I actually could. So I did as soon as I could, and I left it up to my husband. It's not that I didn't care if he did or not, but I wanted it to be his own decision. And so he did, but he actually didn't tell me about it at first. So, and then my daughter, she is 15, and so she is eligible, and I talked to her about it, and she talked to some of her friends, and we have healthcare in our family, so we did talk to friends and family that were in the healthcare, and she did decide to do it on her own. Good. So I left it up to her. My son, who is a really bad asthmatic, he is 11, and we just talked about this last night, and we don't know yet.
Sure.
So when it becomes available, I'll talk a little bit more to him about it. And
that's good to have him thinking about it now.
Yeah, he can't even play sports really because he's so asthmatic.
Sure. Sure. Yeah, and then you just think about, well, if he were to have the worsening lung function that you have when his lungs aren't as good at baseline, it's a scary thing to think about. So
he's been hospitalized for asthmatic attacks and asthma attacks, and no, I wouldn't wish that short of breath on anyone.
Yeah, that's what people say. Especially people who don't have any lung disease. It's not like
No.
anything you've ever had experienced before.
It's horrible.
Yeah.
Not being able to breathe is a big thing, obviously.
Yeah. Yeah, I mean, when you said it takes an hour to get dressed out of the shower, like a normal functioning person, like that was happening to a lot of people. You're not alone in
And
that.
I had no idea. I had no idea the symptoms that was normal that I was experiencing until after the fact, when you started hearing more stories of what patient or what people were experiencing.
Yeah.
So I think I had them all except for the taste and the smell. I didn't lose, and
Sure.
I don't know if I had a fever, like I said.
Sure. Yeah. And lots of people having different lingering symptoms. It's super variable.
Yeah.
A lot of people can't taste like a year
Still.
later.
Yeah.
Yeah.
I noticed that with some friends, they still can't taste, or some things are very bitter for them.
Yep.
Otherwise, they were just fine.
And I think too, from a healthcare provider perspective, that's what makes it so hard. It's different for every person.
Mm-hmm.
You know, so I think we're trying to do a really good job of, if somebody wants to be tested for any reason, I think we're trying hard to just do that because it's coming back.
Yep.
So,
Yeah. And I'm, who knows if I'll get it again, but hoping that, being that I do have the vaccine, if I do get it, I won't experience the symptoms like I did.
Yeah.
I can't.
Yeah, and lots of the studies are saying people who are vaccinated are much less likely to be hospitalized.
Yes.
So,
Yep.
I know there's a lot of not accurate data out there, but the actual scientific studies are saying you're much less likely to be that sick.
Yes.
So hopefully you get sick and you can just
Bounce
have
back.
a couple of days in bed and move on again.
Yes.
And not end up with
Absolutely.
all those profound symptoms. So
It was scary. I think my husband was really, really scared. They did come visit me at the hospital. They just walked up the outside of the hill and could visit me outside and FaceTime me, and I could hear them. So I think they all struggled. I think he realized how bad I actually was when he brought me in and I was admitted, and I was struggling pretty good.
Yeah, and you highlighted kind of the problem with not being able to be transferred. And that's happening again already. I mean, it's the middle of August and we've had several transfers turned down.
Mm-hmm.
So, and that's not just COVID patients. Like, we can't get out traumas
I know.
and like
I know.
appies.
And we're actually outside a lot now. Just wait till it gets cooler, colder, and we're always inside with each other.
And so people are getting burned out and tired.
Mm-hmm.
So the hospitals are shorter staffed. Like, they can't have as many people. And so it's going to be a big issue this fall, I think. So it's starting. It has started.
It has started. Yep. We're seeing more cases in our community and just the state in general also.
Yeah.
It's coming.
Yes. It's here.
It's
We've had several positives.
Yes.
So, and that's what it is. People without COVID, we can't find them beds now. So I'm hoping that everybody's going to do their part to try to slow the spread and
I
do
agree.
what we can do. I mean,
take care of yourself.
Take care of yourselves.
Wear a mask.
Wear a mask. I know everybody's tired of it. Wash your hands, wear your mask, kind of try to be smart and use some common sense. Because it's not just old people. You're not that old and you're healthy. So it happens, and people like you do die.
I feel like I aged about 10 years.
Yeah.
And actually, I looked like I aged 10 years once I got out because I was very dehydrated and just sick.
Yep.
Sick.
Yeah, and you didn't have comorbidities. I think that's a thing that people kind of forget. They think it's, just old people with heart disease and lung disease and smokers, but it's not always.
No. Relatively healthy.
Yeah.
For the most part.
Yeah. And the odds of it being you is little, but it is some people.
It happens.
And
it
draw the short straw. So
it happened.
Yeah. Wash your hands, wear your mask. Try to
vaccinated.
Get your vaccine and try to help slow the spread, because we're doing the best we can, and it's going to be a rough fall and winter, I think, here in healthcare.
I think it is too, but let's hope for the best.
Yeah. Thanks for sharing your story.
Absolutely.